Hi, and welcome back to Body Beautiful. I'm Janelle Marie. We are here with plastic surgeon Dr. Joseph Mealy talking about a bunch of procedures. And our final one, Dr. Mealy, will be
the arm lift.
Arm lift. Oh.
That's the plan.
You know, I'm telling you, women lose weight, men lose weight. They just can't seem to get, well, women mostly, can't seem to get rid of the bat wings. Am I right?
Well, it's tough because that skin stretches when we're bigger, and then when we get smaller, it doesn't recoil.
Well, there's help, right? Because something
Yes.
can be done, and it's called an arm lift or a brachioplasty. Am I correct?
Brachioplasty, correct. Yeah, brachio means arm, and plasty is to change or mold. So we're changing the arm and tightening it up.
And a lot of people are scared to get this because they think, how can you lift an arm? I mean, there's got to be scars that you can see all the time. So let's
Sure.
go to picture number one and talk about how we do this. What's
Okay.
going on?
So in this case, you've got a lot of extra skin and also still a little bit of fat in that upper part of the arm. And what I've done is, there is a scar. So what I've done is I've made an incision that goes from the inner part of the elbow to the back of the armpit.
Okay.
And that way, when the arm's in most positions, the scar is hidden.
Yes.
But that allows me to get rid of all of that skin, all
that's
the extra
wonderful.
skin, and all the fat that's underneath there, and really tighten the arm to the muscle underneath.
And the scar will fade eventually, but I mean, it really, you know, it's pretty hidden under there.
It does, but I always tell people that the most common complaint from arm lifts is the scar, because
Yeah.
everything else about it works so well.
But when you do stomach stapling or something like that, and you've really lost a lot of weight, I mean, it can be annoying to have those big arm flaps.
Yes, and most of my patients are patients who have lost a significant amount of weight, either through diet, exercise, or bariatric surgery, to the point where the skin is so redundant it doesn't really fit in their clothes anymore.
Right. And that's frustrating. Let's go to picture number two.
So here's someone with much more skin than the first one. In fact, it's very crepey, very loose, because she's lost a lot
Yes.
of weight. And it extends, that looseness extends down the side a little bit too, below the axilla, below the armpit. So this incision, again, goes from the elbow to the armpit, but it also goes down the side a little bit so that I
That's
can
amazing.
increase the depths of the axilla. You can see on the where the watermark is, where my name is, on the before picture, there's a shadow just before Joseph.
Yes.
All that skin below there is empty.
That is amazing.
There's no muscle. And
Looks-
then afterwards, you can see the skin's
looks
been tightened
beautiful.
up to that point and tightened up into the axilla.
Looks like a completely different arm on the after photo. I mean, it's done so well and very natural. Let's go to the third picture while you tell me about the downtime.
Sure. So downtime for this type of surgery is a couple of weeks. Most people need to wear their garment day and night for 2 weeks, and then half the time for another 4 weeks.
Okay.
The garment is sort of like a bra with sleeves, so
Okay.
it gives a little bit of compression. Usually there's some swelling in the hands afterwards because we've tightened up
Oh,
that
okay.
skin on the upper arm, but that tends to resolve in a few days to a week. If someone has carpal tunnel, I'm going to worry a little bit more about causing a little more swelling, maybe some symptoms, but if you don't have carpal tunnel before, usually we don't have any symptoms in the hand.
And the third picture?
So the third picture is someone where all the fat is really up close to the axilla, up close to the armpit. So
Yeah.
in these cases, sometimes it's weight loss. Sometimes we're programmed to put all the fat up close. Sometimes it's a lipoma, which is a benign
Right.
growth of fat, and then sometimes it's breast tissue.
And then in the final picture?
And the final picture, also loose skin that extends down the side, so you can see along the side above that bra roll, there's extra skin before.
Yeah.
I've extended the incision down the side to tighten that up, so even in the bra it stays flat.
Can you
and smooth.
do other procedures with the arm lift?
Yeah, I mean, if someone's lost weight, sometimes they're wanting to do other procedures, even tummy tucks, thigh lifts, breast lifts. I think doing it with a breast lift is nice because it's the same area and it really helps with the recovery.
And I do have an email question here for you, Dr.
Sure.
Mealy. It is from Alexander from Saratoga. She wants to know if she does get an arm lift, is it just one arm lift, or if you gain weight or maybe time goes by, do you have to have another one?
So if once we do an arm lift, usually one is enough. Unless
that's
someone
good.
gains a significant amount of weight again and really stretches out the skin. And even that would be difficult because we've removed that fat that likes to get big.
Right. And you know, do you see a lot of men with this procedure? I know a lot of women may get their stomach stapled, but men do also. So do you
Yes.
see a lot of men coming in with
I
this?
see men and women for this, yes.
Yeah. Oh, wow. And
Because it's the same process. The skin gets bigger, gets
Right.
smaller. I probably see more women than men.
oh, okay.
I think it may have to do with the distribution of the fat.
Gotcha.
Men tend not to put as much fat on their arms.
All right, well, again, we are out of time. It always goes so fast, Dr. Mealy, and I want to thank you and Marcia and Monica for letting us use your office. That was very nice of you.
Oh, it's my pleasure. Thanks for coming out.
I know, it always goes so darn fast
It
with
does.
you, but it's okay. We're going to have another Body Beautiful. Remember, if you want more information about any of the procedures you saw today on Body Beautiful, just give the doctor a call, 925-943-6353, or you can go to the websites to see all the before and after pictures. Those websites are drmealy.com and also sanfranciscobreast.com. It has been nice. Thank you so much for joining us on Body Beautiful. Dr. Mealy, thank you so much. We will see you all next time.
Thank you, Janelle.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.